Beyond Our Borders is brought to you by KFC and the Medical City, where patients are partners.
Happy day, everyone, and welcome to Beyond Our Borders. And I'm pleased to welcome our guest this month. He is Dr. Eugene Ramos, the president and CEO of Professional Services, Inc., which is the parent company of several of the medical cities, several hospitals, including the Guam Regional Medical City. Dr. Ramos, ¿cómo está? Thank you for joining us.
Good morning, Guam. Good morning, Nestor and everyone in Guam. We are fine. We are all right. We have not only survived, I think we have become better after 2020, even with the surge that we are now having again. This is the third surge, actually.
Yeah, as I understand it, the National Capital Region, Metro Manila, is under ECQ, is it?
That's right. Lockdown again.
Okay. Dr. Ramos, I have a whole list of all of your accomplishments. Very impressive, but if I read through all this, it would take probably the whole show. But needless to say,
please don't do that. That will embarrass me.
Needless to say, you're very much awarded both in the medical profession and in business. So we're very pleased to have you with us today.
It's an honor.
So let me just start off with the high-level overview of the current situation in the Philippines with respect to the COVID pandemic.
Well, sometime in the latter part of July, there was apparently a clear sign that the cases were ramping up again. And there was actually an earlier recommendation coming from a group, I think the Octa group, that there should be actually an early lockdown, because they anticipated that middle of August, there's going to be a surge again. They were already beginning to identify the variant, the Delta variants. And apparently the testing here, the genotype, the sequencing tests take a while. So we were actually overtaken by this Delta. And I think it's the Delta that's causing all this surge now. Here in Manila, the positivity rate used to be below 10%. Now it's around 15%. No? And total now, we are on an average around about 6,000. It went beyond 10,000 a few days ago, cases every day. And that's a problem. Although, of course, the cases don't seem to be as scary as before. We know better now. We know how to deal with COVID, unlike in March 2020, when we didn't have any idea of how bad this was. So even the people here are kind of more, it's living with COVID already at this time. And people really need to live. And so the problem with this lockdown is that people are not able to go and really find work. No? Some people work on a daily basis and they need to feed their families. So that's the problem that we have. Now in the hospital, what we have is just this morning, we finally decided it was time to already announce publicly that we have reached capacity already for the COVID cases. Now, unlike before, Nestor, when last year everyone was so scared, the cases that were just in the hospital, which actually overwhelmed a number of the hospitals here, were basically COVID. And the doctors themselves were kind of frantic because they did not have a full appreciation of the spectrum of the disease. After that, the non-COVID cases, the cardiovascular cases, the people who were having strokes, people with cancer, they realized that they really just had to toughen up a bit and toughen up a lot, and started to really come back again. And now this COVID thing is already about living with COVID rather than running away from it. The non-COVID cases actually predominate as well in the hospital. And so we just want to make sure that the COVID cases are up to about 25 to 30% of the bed capacity that required of us of the Department of Health. But we no longer want to sacrifice the non-COVID cases, which is the majority of it. At the moment, as far as the data is concerned, I think about 94% of the cases are really mild, and only a small number are really going to moderate to severe. And those are the kind of cases that we admit. There are smaller hospitals. Medical City is a tertiary hospital. We have a very good critical care program. and we have ECMO and all these other modern ways to deal with the problem. So the patients that are coming here are really the severe type.
Yeah.
But then again, yes. Then again, we want to make sure that the vaccination, and that's the difference between 2020 and 2021. Medical City, the doctors are almost 100% vaccinated. It's great. And then down the line, all the other frontliners are also vaccinated around over 90%. No? And this really makes a lot of difference as far as the cases are concerned. In fact, the cases that we have in the ICU are those that are unvaccinated. Unfortunate, yes.
Beyond Our Borders is brought to you by KFC and the Medical City, where patients are partners. Beyond Our Borders is brought to you by KFC and the Medical City, where patients are partners.
Can you talk about the overall rollout of the vaccinations in the Philippines? I know you touched on it earlier, that the impact the pandemic is having on the economy, and the saving grace, the way out, I guess, if you will, is to get as many people vaccinated as possible, as quickly as possible, so that the country can achieve herd immunity. So what's the latest on the vaccination rollout?
So far, I think 20 million doses have been jabbed already, and around just about 9.8, close to 10% of the population of 110 million have been fully vaccinated. Now, that is the irony of it, is that in America, the issue is there are a lot of vaccines, and quite a number of the population don't want to be vaccinated. Here, we cannot even really make accusations of the anti-vax people, because there were no vaccines for the longest time. No? And even now, the vaccines come in trickle, and we are already ramping up, and we are helping the government to actually vaccinate not only the public sector, but also the private sectors. Just yesterday, I think Moderna came, and once in a while, Pfizer and AstraZeneca as well. There would be shipment, and then we ramp it up and get it on. We don't want to waste the vaccines. Unlike that's the paradox of it, or the irony of it, is in America you have a lot of vaccines, and quite a number of Americans don't want to be vaccinated. Here, we have more people really wanting to be vaccinated, but there are no vaccines available.
Yeah. And so how is the Medical City adapting or coping with the pandemic? What changes have you made, if any, to your operations, for example?
Well, actually, Nestor, early on in 2020, what we realized that we could not just be focusing on the COVID cases, because the majority were the non-COVID stuff. So what we had to do first was really to really work on the fear and the perception of the public that the hospital is not a safe place to be. So we actually came up with this concept, which we were actually awarded for, the two system in one complex. So we had a separate we are big. No? We have two separate emergency rooms. We have two different pathways, different sets of elevators, and different floors for COVID and non-COVID cases. Even our intensive care unit, we split them, and then we provided the space that used to be the neurological for the COVID cases, and most of the non-COVID cases were on the other side. So we were really assuring, the optics as well, assuring the public that it is really more safe to be in the hospital than to go to the supermarket, because everyone and everything is being really attended to as far as safety is concerned. We did that in 2020, and it worked as well. No? And then later on, as people became more aware and more relaxed, in terms of more assured of the fact that if you are vaccinated now in 2021, the cases are going to be mild, you go for vaccination. And we had vaccination programs here for a while when we had all these vaccines coming, predominantly the Chinese vaccines. We collaborated closely with the mayor of Pasig City, where the medical city is, and we were able to really help in a way creating. You cannot really create, I say, a bubble that is Pasig because people cross the city lines. No? That's what we did. And then later on, it accelerated our digital transformation program, actually. Whereas before, when you go digital, a lot of the people would resist it. Now they realize that the telemedicine and coming up with a digital backbone was so essential to really surviving this, no, and actually winning over this. So now we are in a state where our digital platforms, our telemedicine, which also provides the home care services that we initially were also kind of slow, but during the pandemic itself, eventually the second surge actually, we were able to really drive it. And so most of those that are really mild don't have to come to the hospital. These are the things that we do, and there is now more virtual interaction between doctors and patients, and it made things much easier. We are helping the government as far as this is concerned.
Yeah, we're looking well into the future. Whenever this pandemic is finally over, will there be a new normal in terms of the medical city's services? You mentioned telemedicine, but I would think that still the face-to-face with your doctor is still going to be the preference.
I think eventually there's going to be a hybrid, because now as people are seeing the magic of or the wonders of telemedicine, there would be cases where you have to come here and you want to see your doctor face to face, and there will be times that you probably would not want to come because the traffic is terrible, or we are a place where we always have typhoons and all these things. So I think the normal now cannot just be about the health. The normal now would also be in relation to what's changing in the environment. No, in Philippines, the global warming problem is really making the Philippines one of the victims or the casualties, I think, and we need to adapt to that in the new normal as well. So this is just emphasizing that health is just one of the many things that really affect, and Medical City is there. No, so we go digital. And we go coming up with new partners, partners and alliances, not necessarily with just health institutions, but with other institutions as well. We find ways to collaborate with suppliers and really elevate the level of the partnership. Now, we are an enterprise now. We have Medical City here, Maine in Pasig. We have Medical City Clark, Medical City Pangasinan up north. We have Medical City in South Luzon, a little down south, and Medical City Iloilo. Now, before, of course, the brand is one, Medical City brand, and the care is the same. We have followed the same template, but now we are interconnecting this with a digital backbone. Then we now have electronic medical records in progress. Regardless whether you are going to be in Iloilo, you find yourself in Iloilo, but you are with Medical City, Maine, you are going to be taken care of there because of the electronic backbone. And I think that's what's going to happen in the near future. And we are going to really collaborate with beyond borders again, with Guam as well. I think before, we have been receiving quite a number of cabbage cases, serious cases that require intervention in Medical City, Maine. And with the pandemic, you would say what would happen to all these cases. But just to assure the people in Guam that regardless of the fact that there was a lot of, bedlam in 2020, we never stopped. We never stopped. Neurosurgical procedures continued. Our coronary revascularization, at the cath lab continued regardless of the pandemic, because we could not really just leave the patients who needed this treatment alone. So now we are also getting quite a number of these cases from Guam, and in the Micronesia area, we have somebody there in Guam. We have a referral office there. He's actually managed by Raquel Ramos, no relation to me, and facilitates everything. Coming. If you have a referral from a doctor and that requires you a real serious surgical intervention, I understand that there are other choices. You can go to the mainland in Hawaii, or some of them go to Taiwan, which is quite near as well. But I think most of those that are really connected to the Philippines would rather have them in the Philippines, no? The Filipino culture and all these things. And we have facilitated that because before the patients are even brought here, Raquel's group there, I think the office is along Tamuning Road, takes care of it. The visa requirements, what the tests that need to be required, what are the things that should be in place, the documentation, so that by the time that they leave Guam and then they reach the airport, somebody's going to pick them up, and then from the airport they go straight to the medical city, and then or medical city regardless, medical city Guam or medical city Maine or other members of the medical city enterprise. And we already have the team here waiting for them. And as soon as everything is okay, also making sure that they are able to fly home, and there's going to be a coordination with the attending physicians in Guam. No? So this is going to be seamless, and we don't want to give this to the patient to worry about. No? Raquel's group there would take care of everything, and that's how we are making sure that the patients don't have to worry about the fear, worry about all these bureaucratic, processes that they have to go through, something that the government can probably improve upon, and then making sure that somebody is going to meet them and somebody is really going to take care of them from the time that they leave Guam to the time that they actually return to Guam.
Beyond Our Borders is brought to you by KFC and the Medical City, where patients are partners. Beyond Our Borders is brought to you by KFC and the Medical City, where patients are partners.
Yeah, that's one of the questions that gets asked a lot. Of course, there is the Guam Regional Medical City here, but for those patients who may need even more specialized care, going to Manila or other provinces where Medical City has operations, how is the immigration, the ease of international travel? That's also addressed in your package. You touched on that a little bit, but so
Correct.
The Philippine government has opened up a little bit for medical travel to the Philippines. Is that correct?
That's correct. Yes, and so we have to make sure that there is really a clear connection with the government. No, and this is not just between Medical City here and Guam. No, we are also collaborating closely with the Guam Regional Medical City, because there are cases there that from here they can actually be brought back to the hospital there. No, but no, the relationship that we have is really making sure that the government issues are actually factored in.
Yeah, we were talking a little bit earlier before we started taping about the fact that you have the Medical City operations in places like Iloilo. There's a big Ilonggo population here in Guam. Tell us a little bit more about that and the interest that's starting to generate about the facility in Iloilo.
Well, we set up Medical City Iloilo, I think, in 2013. And the reason why we actually did that was because when we did a study, Iloilo actually had very high cardiovascular diseases. No, I was really surprised that the incidence or the prevalence of cardiovascular disease and diabetes were quite high in the Iloilo region. We set up the cardiac cath lab and the cardiovascular program of the Medical City Maine and put it there, and then really trained people, and they spent a little time here with Medical City Maine. And that's the reason why we focus on that, because of the need. There was a need for cardiovascular care that is sophisticated for the Ilonggos. Then the other one would be critical care program, because Iloilo for that time did not really have any serious critical care program. No, they have an ICU. The hospitals there may have ICU, but the one who's taking care of it is basically individual doctors with their respective specialties. So the critical care program is really holistic on a higher level. We also set up the acute stroke unit for people with strokes, and this is related to the cardiovascular as well. And never had it before in Iloilo. Now, I was the CEO at the time. While I was medical director here in Maine, I was concurrently CEO there. It was a practice for me. I think it was a laboratory for me. And then at that time, the Iloilo city was also really improving and transforming it into an amazing metropolis. I don't know whether you have been there, Nestor. When was the last time you were there?
Quite a while.
You know, they really rehabilitated the river, the Iloilo River, and then they came up with this walk. They call this now the Esplanade, which has now surrounded all over, very, very slowly, but up to the other side. No? And Medical City was so lucky because right in front of the Esplanade is the Medical City. So in terms of mental health, you know, when I would be there, I would make sure that in the morning I would wake up and before drink my coffee along the path and really jog all over across. No? It's a nice place. The river is clean and it's fully rehabilitated. And the whole city itself has really blossomed into a modern metropolis with bike lanes, you know, things that were never actually considered here in Manila. So other than that, the people who are there and who actually staff are with the Medical City brand of care. Expertise, quite a number of our cardiologists and interventional cardiologists trained here, and some of them trained in Taiwan as well. So the care, our critical care program there after the CABG or the procedure, also trained here. And the critical care program of the Medical City is the pioneer of critical care in the Philippines. And the leadership that we have is not for ourselves, but really to help the Philippines as well. So Iloilo is so lucky that they have that. And just to tell the Ilonggos that, yeah, it's a beautiful place there. Medical City, Iloilo is a beautiful place for mental health and for cardiovascular, cancer as well, and neurological health. So
yeah, I haven't been to Iloilo in many years, but I have heard many good things that it's rivaling Cebu. You know, it's nearby. You know, as an advancement of just the community and the modernization and stuff like that.
Beyond Our Borders is brought to you by KFC and the Medical City, where patients are partners. Beyond Our Borders is brought to you by KFC and the Medical City, where patients are partners.
So if a patient has from Guam has a preference to go to Medical City in Iloilo, you can arrange for that.
Yes, okay. Well, you know, it really depends on where the patient's relatives really prefer. No? They can also go to Medical City Clark. And Medical City Clark also has a good cardiovascular program. The critical care program there also is coming from the Maine. And it's a beautiful place as well. And it's a bustling place now with the new modern airport. So those are things that really augur well for the Philippines, I guess, and for the healthcare here in the Philippines.
Yeah, you mentioned diabetes and heart disease as some of the primary ailments of patients from the Iloilo area and in other places. That also happens to be, two of the biggest problems here in Guam.
That's correct. Yes, it's a lifestyle connected disease, Nestor, and other than the fact that we always get them at the latter part. You know, the complications of diabetes is cardiovascular or stroke or hemodialysis, kidney. You know, a lot of things can still be done at the earlier level, no? And this is the preventive health that actually we should really emphasize, and Medical City is up to that as well. But I think the media can actually help in terms of influencing and the behaviors of a lot of the people that we take care of.
Yeah, and you work very closely with GRMC in Guam.
Very closely.
Can you explain a little bit about that?
Well, Other than the fact that we were building and building here, we realized that there was also a need in Guam, and that's why we built the Guam Regional Medical City. But of course, it was we were ambitious, and we thought that we wanted to give the brand of care, the Philippine healthcare brand, the Filipino way, to the Guamanians, because we understand that quite a number of the population in Guam are really coming from the Philippines. No? And let's face it, when it comes to nursing, when it comes to healthcare, not only in terms of the expertise, but also in terms of the compassion, no? The Filipino way, we thought that we could make a difference in American healthcare with this Guam Regional Medical City. Of course, we realized that we had to adapt to the requirements of the government. It's a different healthcare. It's an expensive healthcare, but of course that's the healthcare of the government, and that's where the insurance issues, the Medicare, Medicaid, and all these other things. And there was also a problem with the staffing as well, because I think initially there were people coming from the mainland. And nurses also was a problem. I think one of the problems of Guam Regional Medical City at this point, they are in need of nurses. And you understand now that the Philippines, there's a lot of poaching of our nurses. I think you have to agree that the Filipino nurses are the best in the world, and so they are preferred in London, in all those highly developed nations, which is really unfair to us, right? Because we train them, we really develop them, and then they get the benefits of all these nurses because they can pay more. I think that's also the problem in Guam. Quite a number of the nurses prefer to go to the mainland. And so we have to do something that we can collaborate with Philippines, so that Philippines, Medical City Philippines, and the Guam Regional Medical City can also collaborate, that we can actually send nurses there as well with the help of the government. Yes.
That's absolutely been, one of the challenges over the years on Guam. Doc, we've got only a couple of minutes left. I wanted to just give you a chance to maybe venture a guess. Is there light at the end of the tunnel of when this pandemic is going to be over in the Philippines?
Well, from the science point, Nestor, I think, we would like to believe that there's going to be an end to this. Sometimes, you just wake up in the morning and then you kind of say, there's no more COVID. No? But I think people will have to learn to live with COVID. And it's going to be like the flu, and it will require a yearly booster shot. No? That's how it is. No, because I think at the end of the tunnel, what's happening there is that all the reasons why this virus happened in the first place, let's forget about the conspiracy theories now. The global warming, all these changes are going to have an impact on health, impact on the behavior of the viruses, behavior of the animals as well. So, it's not like we were able to deal with the smallpox and all these deadly diseases before, but with the vaccination. But now, with the fact that politics has come in and vaccination cannot proceed as desired, we cannot say that do we see a light at the end of the tunnel, and we kind of just be optimistic. That people have to realize that viruses are going to be here with us. We have to prepare for the emerging viruses, which may be tougher, and we just have to be prepared for them. But that's how it is. I really don't think that the viral problem is going to disappear.
All right. Thank you, Doc. Dr. Eugene Ramos is the president and CEO of Professional Services, Inc., the parent of the Medical City Group, including the Guam Regional Medical City. Our pleasure to have you, Doc. Thanks for joining us.
Thank you, Nestor. Thank you very much. It's an honor.
I'm Nestor Licanto. Thanks for watching, everyone. We'll see you again next month on Beyond Our Borders.
Beyond Our Borders is brought to you by KFC and the Medical City, where patients are partners.